Hello students, today we will discuss about the Norma Frontalis part of the skull. Now when you will see the skull from the front, that is known as Norma Frontalis, what you are going to study in this part. So let's discuss one by one. So the Norma Frontalis is roughly oval in the outline, but when you will see it, you will realize that it is wider in the upper part as compared to lower part. So then you can see in this view, this is the Norma Frontalis, and you will find that this is the wider upper part as compared to the lower area. So that's why it is oval in shape with the wider upper part. Now what are the bones we will have in this Norma Frontalis? The first is the frontal bone, then you will have the right and left nasal bones, then you will have zygomatic bone, you have right and left maxilla and the mandible. So now here if you will see in this Norma Frontalis, what are the bones here? So this is your frontal bone. You know that frontal bone is a single bone which is present in the forehead. Below that you will find these two short right and left nasal bones which are present on the front of your skull. Apart from that, you will have the two zygomatic bones which are present on the sides and they are known as cheekbones. Then you will have the bones which are present here is your right and left maxilla. So these are the two maxillary bones, and you have a single bone which is present here is the mandible, which is going to form your lower jaw. So when you will see the bones which are present in the Norma Frontalis, you have to understand that from above downward, these bones are the frontal bone, which is a single individual bone. Then you will have the two maxillary bone which is going to form your upper jaw. Then you will have the mandible. Then you will have the sides of your zygomatic bone, and these are the two nasal bones. Clear? So these are the bones which are going to form your Norma Frontalis. Now when you will see the frontal bone, this frontal bone is having the irregularity in the lower part. Now why? Because it is interrupted by the orbit and anterior bony aperture of the nose. So where is the orbit? Now these are the two orbits. So when you will see the frontal bone, this frontal bone is not going downward, but it is here interrupted by these two orbits, plus it is having the anterior bony aperture for the nose. So in this part, if you will see that here is a joint, and this joint is known as the suture, and this suture line is between the frontal bone and the nasal bones. So what you will see here that this area is for your nose. So this is your nasal aperture. But in the upper part of the nasal aperture, here you are having the right and left nasal bone, while this remaining part is later on completed by the nasal cartilages. Clear? So whenever you are reading the Norma Frontalis, you are having these 5 bones. What are the name of these 5 bones? Frontal bone, right and left nasal bone, zygomatic bone, right and left maxilla and mandible. Now these right and left zygomatic bones are going to form your superolateral part of the cheek. So when you will see on your face, these superolateral part of your cheeks are formed by the zygomatic bone. Now, what are the areas of study on Norma Frontalis? So if I want to read the Norma Frontalis, I will divide this Norma Frontalis in the 4 part: frontal region, orbital region, anterior nasal aperture which is pyriform shape, and the last part is lower part of the face. So these are your frontal region. Clear? Then you will have the orbital openings, then you will have your nasal aperture, and then you will have this remaining part of the face. So let's discuss one by one. First is the frontal region. Now when you will see the frontal region, on the frontal region you will find the superciliary arch and the glabella. These are the two most important features which you are reading firstly. Now what is superciliary arches? Now superciliary arches are nothing but these are the curved elevated round area above the medial part of each orbit. Now when you will see the orbit, this is the medial part of the orbit, and above this medial part these areas are known as superciliary arches on the Norma Frontalis. Clear? Now it overlies the frontal sinus and they are more prominent in the males. What does it mean? That if you will open this part, you will find the air spaces in both the side, and these air spaces are known as frontal sinuses, which lies inside the frontal bone. Now what is glabella? Now this is something you have the question in exam. So glabella is a median elevation connecting the two superciliary arches. So when you will see the superciliary arches, you will find that these arches are connected by this middle portion, and this portion is known as glabella. So below the glabella, the skull recedes to frontonasal suture at the root of nose. So this is your nasal bone, this is your frontal bone. So these sutures are known as frontonasal suture. So this area just adjacent to the frontonasal suture between the two these superciliary arches is known as glabella. Clear? So suppose in bone I have to mark the glabella. Where is the glabella? So these are the two superciliary arches which are present on the medial side of the orbit, and this is the portion, and this portion is known as glabella. Clear? So whenever you are marking the glabella, you have to keep this thing in mind that glabella lies just above the suture line. Which suture line? This suture line. And what is the name of this suture line? This suture line is known as frontonasal suture. So just above the frontonasal suture, you will have this glabella. Clear? Now the next point comes is nasion. Now nasion is a median point at the root of the nose where the internasal suture meeting with the frontonasal suture. Now here, if you will see the two suture lines, now this is your internasal suture. Clear? Now this suture is between the two nasal bone, and this horizontal suture is a suture between the frontal and nasal bone. So this is your frontonasal suture. Now the meeting point of both these suture. Now this meeting point is known as nasion. So what is the difference between the glabella and nasion? So glabella is the area which lies adjacent to the frontonasal suture, connect the both superciliary arches. What is nasion? Nasion is a point of intersection between the two suture, internasal suture and frontonasal suture. So that is the difference between the definition of glabella and nasion. Then you will have the next feature is frontal tuber or frontal eminence. So frontal tuber or frontal eminence is a low rounded elevation above the superciliary arches, one on each side. So now this is your superciliary arches. Above the superciliary arches, here you will have the frontal eminences. So these are your frontal eminence or frontal tuber, and it is more prominent in the females and in the children. Clear? So in this slide you are having the two very important word, superciliary arch and glabella. The second thing is that you should know the difference between the glabella and nasion. Then what are the features on orbital region in the Norma Frontalis? When you will see the orbital openings, they are almost quadrangular, and you will find that they are bounded by the four boundaries. So because they are quadrangular, you have supraorbital margin. Supra means above. So above the orbit, supraorbital margin. Then you will have infraorbital margin, and you have the medial margin and lateral margin. Clear? So in this way, when you are reading the orbital opening in the Norma Frontalis, you have to first understand that we will read on the four places: supraorbital, infraorbital, medial and lateral margins. So let's discuss one by one. First is the supraorbital margin. Now this supraorbital margin purely and purely made up of frontal bone, which you can see that it is the frontal bone only which is forming the supraorbital margin. Now at the junction of the lateral 2/3 and medial 1/3, you will have a very important foramen is known as supraorbital foramen, and sometimes this foramen is open, then it is known as notch. So here you can see that this is the junction of 1/3 medially, 2/3 laterally, and this junction is showing the supraorbital foramen, or if it is open, then it is known as supraorbital notch. Then you will have infraorbital margin. Now when you will see the infraorbital margin, now this infraorbital margin is contributed by two bones. This is zygomatic bone, because here you can see the suture line, and this is maxilla. So maxilla is forming the medial side of the infraorbital margin, while the zygomatic bone is forming the lateral part of infraorbital margin. Then you will have medial orbital margin. Now the medial margin is formed by the frontal bone above and by the lacrimal crest of the frontal process of maxilla. So what are the bones? First maxilla below and frontal bone above. Now if you will see in this image where these two bones are. Now if you will see the medial margin, now on this medial margin, first you have to see for the suture line. Now this is the suture line. Now above this suture, you will have this projection of the frontal bone, and this projection is going to make a joint with the maxilla. That's why this process is known as the maxillary process of frontal bone. Now this is going to make a joint with this part of your maxilla, and this part of the maxilla is known as frontal process of maxilla. So this is going to make a joint with the frontal bone. So this part of the maxilla is known as frontal process of maxilla. So medially, if you will see on the medial side of the orbit, I am not going inside the orbit, I am just talking about the margin. On the margin, you will find there is a suture line between the frontal bone and maxillary bone, and this is going to form medial orbital margin. Now what is the lateral orbital margin? Now when you will see the lateral side, you can see that this is the suture line here. So this is the zygomatic bone. So this zygomatic bone is laterally making a joint with the lower projection of frontal bone. Now this lower projection of frontal bone towards the zygomatic bone is known as zygomatic process of frontal bone, and this is known as frontal process of zygomatic bone. So it is formed mostly by the frontal process of zygomatic bone and completed above by the zygomatic process of frontal bone. Clear? And what is the name of suture? The name of suture is frontozygomatic suture. So when you are reading the orbital region on the Norma Frontalis, what you have to understand that in this orbital region there are four borders. Superior border is purely contributed by the frontal bone. Medial border is contributed by the frontal bone and the maxillary bone. The inferior border is contributed by the maxilla and zygomatic bone, and lateral border is contributed by the frontal bone and zygomatic bone. Now, what about the next part is anterior bony aperture of the nose. Now, when you will see the bony aperture, now this is your anterior bony nasal aperture. Now, in this nasal aperture, we have already seen that the upper part is filled by the nasal bones. So these are the two nasal bones. Now remaining part of this nasal aperture is filled by the nasal cartilages. Now what are the boundaries of this nasal aperture? Above you will have the lower border of nasal bone. Now when the nasal bones will come here, now this aperture is above bounded by the lower border of nasal bone. Below, it is formed by the nasal notch of the maxilla each side. Now this is your maxillary bone. So this is the one side maxilla and this is another side of the maxilla. Clear? So this gap which is present in the dry skull is bounded by two bones. In upper part you will have the nasal bones. On the sides and in lower part you will have the maxillary bone. Clear? Now, what are the features on this nasal aperture? So, first is that articulation of the nasal bone. So, this nasal bone anteriorly articulate with the opposite side of the nasal bone with internasal suture. So, this is internasal suture where the right and left nasal bones are articulating with each other. Then the second is posterior articulation where you have the articulation with the frontal process of maxilla. It is not frontal bone, it is frontal process of maxilla. You can see that this is the projection of the maxilla, and this projection is going to make a joint with the frontal bone. That's why it is known as frontal process of maxilla. But on this medial side, it is articulating with the nasal bone also. So, here you will have a joint between the nasal bone and the frontal process of maxilla. Superiorly, now if you will see the superior articulation of the nasal bone, they are going to make a joint with the frontal bone, and this line is known as frontonasal suture. Now, what is the inferior articulation of the nasal bone? Inferiorly, in dry skull, you will find that these borders are free in dry skull. But in living person, we have the nasal cartilages, and these nasal cartilages will come and make a articulation with these lower free margins of nasal bone. Now, what are the another important feature? Now, these are the two very commonly asked question in your spotting. What are these two questions? First question is that what do you mean by the anterior nasal spine? Now, here in this image, you will find that this meeting point of your two maxilla is having a projection in a dry skull that is known as anterior nasal spine. So, it is a sharp projection in the median plane in lower boundary of piriform aperture. So, in this piriform aperture, this lower border is having a sharp anterior end, and this sharp anterior end is known as anterior nasal spine. Then where is renion? Now, what is renion? Renion is different from the anterior nasal spine. Renion is labeled as a lowermost point of internasal suture. So, this is your internasal suture, and this lowermost point of internasal suture is known as renion. Clear? So, there are two different points. The anterior nasal aperture is here, the renion is here. Clear? So, internasal suture is having the midline point in upper part is known as nasion, this is known as renion, and this area is known as glabella. Now, what are the structures or the bones present in the lower part of the face? Now, when you will see the Norma Frontalis, after reading the frontal portion, orbital portion, and this middle portion of your nasal aperture, you will find the remaining face is formed by the three bones: maxilla, zygomatic bone, and mandible. So, where is the maxilla? So, this is your maxillary bone. Then you will have this zygomatic bone laterally, and in lower part you will have a big bone in the lower jaw is mandible. So, let us discuss the important features of these three bones which you are able to appreciate in Norma Frontalis. First is the maxilla. Maxilla contributes a large share in the formation of facial skeleton. The anterior surface of the body of maxilla is having the following features in the Norma Frontalis. We are not discussing the whole maxilla. I am touching only the part of the maxilla which will come across when you are reading the Norma Frontalis part of the skull. So, the first is the nasal notch. So, this is the nasal notch which is present on the medial side of your maxilla. So, this is known as nasal notch. The second is anterior nasal spine. Now, this point is known as anterior nasal spine. Then you will have infraorbital foramen. Infraorbital foramen is here, which is a very important finding. It is present almost 1 centimeter below the infraorbital margin. Now, you have the canine fossa. Canine fossa lies lateral to the canine eminence, and where you will mark this below the infraorbital foramen. So, below the infraorbital foramen, you will find the depressions on both the side of on the maxillas, and these depressions are known as canine fossa, and these canine fossa are just lateral to these eminence of the canine tooth, and these are known as canine eminence. Clear? Then you will have incisive fossa, and the incisive fossa lies above the incisor teeth. So this is your incisor teeth, and above that you will have the depression is known as incisive fossa. So when you are reading the Norma Frontalis on maxilla, the important features you will find, the most important is infraorbital foramen, and below the infraorbital foramen you will have a depression is known as canine fossa. Now apart from that, when you will read the Norma Frontalis, you are able to see the 3 processes of maxilla. There are more than 3 processes. We are not able to see all the processes in Norma Frontalis. In Norma Frontalis, you are able to appreciate 3 processes of maxilla. What are the name? Frontal process, zygomatic process, and the alveolar process of maxilla. So first is the frontal process. The frontal process of maxilla is here, and this frontal process is directed upward, and this frontal process is articulating anteriorly with the nasal bone. Here you can see this is the nasal bone, and ultimately in upper part it is articulating here with this frontal bone, and on the inner side, or you can say posteriorly, it is articulating here with the lacrimal bone. So when you are reading the frontal process, you will have the 3 bone articulation. First is the nasal bone, second is the lacrimal bone, and third is the frontal bone. So where you have these 3 bones, again you can see this is your nasal bone, which is articulating on the anterior side of the process. This is the lacrimal bone, which is articulating on the posterior side of the process, and this is the frontal bone, which is articulating on the upper part of the process. And in this way you can see that this process is now surrounded from all the 3 sides by the 3 bones. Now what is the zygomatic process of maxilla? So the zygomatic process of maxilla is short and stout. It articulates with the zygomatic bone. So this part of the maxilla is known as zygomatic process, and this process faces laterally, where it is going to make a joint with the zygomatic bone. Then you will have alveolar process. Now this is the alveolar process, and this alveolar process projects downward, and it is having the sockets for your upper teeth. So it is the part which have the sockets for your upper teeth. Now here in this individual image of your maxilla, you can see that medially the maxilla is having this aperture. This aperture is for the nose. Then this is the body, where you will have this infraorbital foramen, and you can see the 3 processes. This is the frontal process, this is your alveolar process, and this is your zygomatic process of maxilla. Now the next bone is zygomatic bone. The zygomatic bone is also known as malar bone. Now this is very commonly asked question in your MCQ. Which of the following bone is known as malar bone? Now this zygomatic bone is going to form the prominence of the cheek. So this is again the next question. The prominence of cheek is due to which bone? Now on the zygomatic bone, on Norma Frontalis, you have a very important foramen, and this foramen is here. This is known as zygomaticofacial foramen. And if you see the zygomatic bone, it is making a joint on the face with the maxilla here, and here it is making a joint with the frontal bone here. Now posteriorly it is making a part of the zygomatic arch that will come in the norma lateralis. So when you are reading the Norma Frontalis, on zygomatic bone you have 2 important questions, that zygomatic bone is responsible to form these eminences on your cheek, and second thing, here you have the zygomaticofacial foramina. Now what about the mandible bone in term of Norma Frontalis? So mandible bone from the lower jaw, that we all know, and the upper border or the alveolar arch lodges the teeth of your lower jaw. So this is your upper arch or the alveolar arch of the mandible, where you are having the lower jaw teeth. Clear? the lower border or the base is there. So when you will see, this is your lower border of the mandible, or it is known as base of the mandible. The middle point of the base is called as mental point or gnathion. Mental point or gnathion, while the point of the angle of mandible is known as gonion. So these are again the two questions. What is gonion? What is gnathion? So what is gonion? Gonion means the angle. So this is the angle of mandible, and this point is known as gonion. So where you will find the gonion? Gonion is the angle of mandible. So this is the angle of mandible, and this angle of mandible is known as gonion. But when we are talking about the gnathion, now this gnathion is a mental point which is a middle point of the base. So now where is the base? Now this is the whole base. Now this middle point of the base is known as gnathion. Clear? So gnathion is here, gonion is here. Then what are the other features of the mandible? You will have the symphysis menti. So when you will see the mandible, now here you will have the symphysis menti in the midline. So this is your symphysis menti in the midline. Then you will have the mental protuberance. So these are the two projections is known as mental protuberance. Then you will have mental tubercle, and mental tubercles are not present here, mental tubercles are here. Now these projections are known as mental tubercle. Then you will have mental foramen. So mental foramens are present here on both the side of the mandible. Then you will have an oblique line. Now this oblique line starts from the mental tubercle and it go posteriorly and continue with this anterior border of the ramus of mandible. Clear? So on the mandible, what are the features you are going to see? You are going to see the mental point or the gnathion. You will have the gonion. Then you will see the symphysis menti, which is midline structure. Below that you will have the mental tubercle. Then you will have the mental protuberance. Then you will have the mental tubercles. From the mental tubercles, you will have the origin of oblique line, and you have very important feature is the mental foramen. Clear? Now what are the sutures which we are able to see on the Norma Frontalis? Now when you will talk about the sutures, you will have the internasal suture. Now what is internasal suture? This is the joint between the two bone is known as internasal suture. Then frontonasal suture. It is a joint between the frontal bone and the nasal bone. Then you will have frontomaxillary suture. So it is a joint here between the frontal bone and maxillary bone. Then you will have nasomaxillary suture. Now this is the joint between the nasal bone and maxilla is nasomaxillary suture. Then you will have lacrimomaxillary suture. Now here you will have the joint between the lacrimal bone and maxilla. Then you will have intermaxillary suture. So this is the intermaxillary suture. Then you will have zygomatico-maxillary suture. So here is the joint between the zygomatic bone and the maxilla. And lastly you will have zygomatico-frontal suture. So it is here between the zygomatic bone and frontal bone. Clear? So whenever you are reading the Norma Frontalis, you will have these 8 sutures between the different bones on the front of your face. Now, which are the structures passing through these different foramina which you are going to read on Norma Frontalis? So first is the supraorbital foramen. Now this supraorbital foramen which is present here allow the passage for two structure. One is the supraorbital nerve and another is supraorbital artery, which you can see here. The structures are passing through this and they are coming on the forehead to supply this skin and the area on forehead. Then you will have external nasal nerve. This external nasal nerve emerges between the lower part of nasal bone and upper part of nasal cartilage. So here you can see that this is the lower border of your nasal bone. Now at this point, this nerve which you can see here is coming out, and this nerve will pass between the nasal cartilage and the lower border of nasal bone. Then you will have infraorbital foramen, and through this infraorbital foramen you can see the infraorbital nerve and the arteries are coming out to supply the area below the orbit. Then you will have zygomatico-facial foramen. Now this zygomatico-facial foramen on both the sides allow passage to the zygomaticofacial nerve and vessels. And lastly, the mental foramen. Now, mental foramen is present here, and this mental foramen allow exit of the mental nerve and mental arteries. Those will come out here on the outer side of the mandible, and they will supply the skin over the mandible. Clear? Now, the important thing which you have to keep in mind, that supraorbital foramen, infraorbital foramen and mental foramen, they all three lies in a single vertical line. If you will draw a straight vertical line, you will find that this line is going to cross all these three foramen, supraorbital, infraorbital and mental foramen. Now, what is the importance of the Norma Frontalis? Now, when we will talk about the fractures of the bone, the nasal bone is one of the most commonly get fractured bone on the face. Now, the mandible and the parietal eminences are next bones to be get fractured after the nasal bone. Clear? So, now at the end of this session of Norma Frontalis, you are having the idea about the bones which are forming the Norma Frontalis, how to read the Norma Frontalis in the four region: frontal region, orbital region, nasal aperture and the face. Apart from that, you have to understand that which are the foramens and through which foramen which structure will come out. So, this is all for the session. Thank you.